Hushar.
Namaskar ji. Good morning, everyone.
Good morning, sir.
Good morning.
Good morning, sir.
Morning, sir.
Good morning, sir.
Good morning, sir.
Very good
Good
morning.
morning, Sarji.
Good morning.
Good morning.
Very good morning.
Good morning, sir.
Very good morning. Okay, let's start now. So we already have understood about the different systems. Like bind means a muscular system who do lots of movements. Because the meaning of bind, movement. The meaning of heat, circulatory system, circulation. The meaning of hotness, nervous system. The meaning of humidity here, digestive system. The meaning of dryness, skin system, or we are telling it integumentary. Integumentary system, and the meaning of coldness will be bone system or osseous system. Right? In the bind, we are also talking about all the joints. हम बिंड में सारे joints की भी बात कर. In the heat, other than circulatory system, we are talking about all the blood vessels, means blood system, hemic system. Hemic system. In the hotness, we are also talking about the endocrine system. So when we are coming to the humidity, other than digestive system, we are talking about lymphatic system, lymph. We know the white liquid, white flow of the lymphatic system. So we are coming to the skin integumentary system and all the connective tissue, like we are having, we'll discuss in the future. And when we coming to the coldness, we are also talking about the urinogenital system, urinary system and the genital system. Urinary plus genital system. Right? It's like this. We can consider this is the home, right? This is the very big home. Very एक mansion महल, ये एक बहुत बड़ा महल है. Mansion. So this is the entry number 1. Or I will make mention in a different way. Give me 1 minute. Suppose there are many mansion. Mansion 1, mention 2, ये अलग mention. Mention 3. ऐसे अलग अलग महल है. ये पहला महल. ये दूसरा और ये तीसरा. So the step number 1, we have to take the entry. So this is the gate entry. For this maybe entries here, for maybe entries here. Right? For example, we are taking the entry in the digestive system. Suppose this is the digestive system. If you are taking entry from here, then you will enter in the nervous system. And you are taking entry from here, you will enter in the circulatory system. So every different mention is entirely different system, right? जैसे मैंने अगर ह्यूमिडिटी के पॉइंट को प्लेस किया तो आई विल इंटर इन द डाइजेस्टिव सिस्टम. मैंने अगर हीट के पॉइंट को स्टिमुलेट किया, आई विल इंटर इन द सर्कुलेटरी सिस्टम. If I'm entering the hotness, I will be entering in the nervous system. तो ये बटन है, ये रिमोट का बटन है कि कौन सा बटन दबाया वहीं इंटर हो जाएंगे. It's like an entry gate. Suppose I am entering in the digestive system. So now I have this huge area of the digestive system. ये तो पहला स्टेप था. अब now in the digestive system we are having multiple rooms. इसमें भी बहुत रूम है हमारे पास. हमारा माउथ है, फूड पाइप है, इसोफेगस. We are having stomach. We are having duodenum. Then we are having remaining part of the small intestine, jejunum, ileum. Then we have large intestine and we have rectum. Inside the digestive system, there are many things. So we have to do the further division. So mouth and esophagus is wind. Then stomach will be the heat. Duodenum will be the hotness. Then jejunum, ileum will be the humidity. Large intestine will be the dryness. And the rectum will be coldness. अब एक बटन और दबाना. Now, when you are putting first button, when you are entering from the first gate, so this is the humidity gate. You reach in the digestive system. You are not pressing heat. Otherwise, you could reach in the circulatory system. You are not pressing hotness. Otherwise, you can reach to the nervous system. You are pressing the humidity, so reaching in the digestive system. But the digestive system is very big. Suppose someone is suffering with the mouth ulcer, someone is suffering with the stomach ulcer, or the duodenal ulcer, or some problem in the small intestine, or some problem in the large intestine, like the Crohn's disease, or some problem in the last part of the large intestine, that is the maybe piles, right? Or some problem maybe in the rectum, near the rectum. तो आखिर आपको कहाँ ट्रीटमेंट करना है? किसी का पाइल्स का ट्रीटमेंट करना है ना, तो एलआई करना हो, स्टमक का करना है, यहाँ करना होगा. In this way, we have to enter through the second door. Suppose I want to treat the stomach ulcer. So I will enter here now. My second door is heat. So the first door was humidity, that is a digestive system. And the second door is heat. And now I reached in the stomach. अब मैं stomach में पहुंच गया. Now I will do the treatment. Someone is suffering with the ulcer. Yesterday I told you the ulcer means dryness. What is the treatment? I will study the dryness. Then dryness will be the main action. So we can add also more points. Suppose I want to study the dryness. Use the double grandmother law. Double grandmother law का प्रयोग करेंगे. What is the double grandmother law? Who is the grandmother of dryness? Heat. Heat is the grandmother. Who is the grandmother of heat? Coldness. The first grandmother and the second grandmother. And we always do opposite action on the grandmother. तो यहाँ पर हम set it कर रहे हैं, तो इसको टर्न करेंगे अपोजिट एक्शन. अब इसे टर्न कर रहे हैं, तो इसे सेड इट करेंगे. So what is the treatment? Dryness, sedation, heat, tonification, coldness, sedation. This is the treatment for stomach ulcer. ये stomach ulcer का treatment. The main action is dryness, sedation. So this will be the control. तो देखिए क्या स्टेप थे हमारे. सबसे पहले हमने ह्यूमिडिटी को चुना. ह्यूमिडिटी मीन्स डाइजेस्टिव सिस्टम. Then we chosen the heat, means stomach. Now we are doing the treatment: dryness, sedation, heat tonification, coldness, sedation. These are treatment. Treatment को हम ऐसे लिखते हैं TYT, capital T and the small t. This is a sign of treatment. And the main action is dryness, sedation. This is a controller. तो हमने ये लिया. This is our palm. So first step, humidity. Choosing the humidity. So we know there are 6 meridian here. हमारी 6 meridian. 1, 2, 3, 4, 5, and 6. And this is the controller. There are 2 controllers. One control is the here triple warmer, the central one, or we are telling it is spinal cord meridian. And second controller is this governing vessel meridian. It is the super controller. And this is the controller. So the step number 1, and in this 6 meridian, we know the first one is LI meridian. LI means dryness meridian. The central one is triple warmer meridian. We know that is the hotness meridian. The third one is here, the small intestine meridian. We know that is the heat meridian. We already aware with these 3 meridians.